Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years.
Hello and welcome. Today's presentation, Oh, My Aching Feet, Recognizing Common Foot and Ankle Problems, is presented by Dr. Jet Liu, an orthopedic surgeon with the Washington Township Medical Foundation. Without further ado, please welcome Dr. Jet Liu.
Good evening, everyone. Thanks for joining me. My name is Jet Liu, and I work with the Washington Hospital as an orthopedic surgeon. And I'm very happy and honored to stand in front of you guys tonight and kind of introduce a little bit of what I deal with on a daily basis, aching feet on different patients. And hopefully within the next hour or so, I get to talk a little bit about the common problems that you might face and a common treatment options that might get you back to your feet and get back to you doing the activities that you like to do. All right, without further ado, first of all, a lot of us stand on our feet, walk on our feet, and doing activity on our feet. And I challenge you, probably you don't know too much about your feet. I don't know when's the last time you looked down on the shape and the size of your feet, but I think that's one of the things that we have to kind of address first. So first of all, if you look down and you might recognize, what is really your foot shaped like. Some of us have a little bit of leeway on either way. A lot of us are neutral, but also some of us have a little flat foot and other of us have a little high arched as well. As you can see from the picture down below, there's a spectrum of the shapes. On the left side, you have a little bit of flat foot, meaning that there's a little bit of low arch in the inner side of your foot, to the spectrum on the right, which is you have a little bit of high arch foot, which naturally means that your foot is more tilted. And have a little bit, a really high arch in the middle. Why are these things important? As you know, we do stand on our foot and ankle throughout our day, and these structures takes majority of our weight as we do our activities. And over time, the stress applied through them can cause some different problems that you might ignore, and gradually they might become something more and chronic. So first of all, what is a flat foot? Some of us might ask ourselves, and they might have these over time. So the flat foot is something have a low arch, as you can see from the picture there. The heel and toes turns out, and as a result, if you apply forces through that, there's increased tension on the inner side of your ankle and the foot, and then these can be commonly results in some problems of the structures on the inside. For example, there's a tendon on the inside of your ankle called the posterior tibialis tendon, which we'll kind of touch on briefly in a later presentation. But also there's some structure in the bottom of your foot called plantar fascia, which most of us probably have heard one way or another, that can be always also stressed with a force applied through them with the flat foot. On the other spectrum, there's a high arch foot. These are kind of the opposite of what we expect from a flat foot. Not only if you have a high arch, but also you have a heel that's turned outward or inward, and the outside of the ankle is turning outward. As a result, there's a more increased tension through the outside of your foot. And just so you expect, it will be everything kind of the opposite of the flat foot. Again, there are some structures on the outside. There's also another tendon called the peroneal tendon that can be irritated. And also, as we commonly do in part of our life, we sprain our ankles one way or another. And most of these sprains, you turn your ankles outward. And these, if you have alignment problems, and these might put you in the increased risk of ankle sprains as well. And finally, there are bones on the outside of our foot as well. And over time, there's some increased stress through these bones that they might be not used to, and that can lead to stress fractures, like your fifth toe. And again, it's important to kind of note the shape of your foot, again, to recognize the fact that these can lead to various chronic conditions of your foot and ankle. And I'd like to kind of spend the rest of the presentation kind of hit on different areas of the foot. That might give you pain, and hopefully I can touch on some of the most common problems that can associate with different areas that you might have the pain. So let's dive right into it. So first of all, someone would say, doctor, I have a lot of pain over the top or the inner side of my big toe over a long time. And these are very painful to touch. These flares up once in a while. And over time, I can feel like I have a little bit more limited mobility, meaning more stiffness across these toes. And every time I move these toes, that would be very painful. Well, if that's the case, then the most common things you might have is some degenerative conditions or arthritic conditions associated with the great toe. And these are actually the most common arthritic conditions in our foot. And as you can see from the pictures, and these might be something that can happen if you have one of these flare-ups. And what people feel is not only you have the pain and the swelling when you have a flare-up, but also the stiffness. And sometimes you can even have a bone spur sitting on the top of your foot. If the pain is worse and you decide to go see a physician or getting an x-ray, you might see the bone spur translate to something like the x-ray you see on the bottom left there. A big bone spur that can translate into a bony prominence on the top of your toe. And obviously these are arthritic conditions, so they do get worse with a lot of aggravating activities such as walking, running. In my experience, some patients like to kneel doing their regular day job, or some religious reasons with praying, and these are very debilitating when they try to do that as well. So what can we do to treat it? So these conditions are most commonly treated and successfully treated with non-surgical options, and these options are meant to minimize the stress and minimize the motion across the big toe, so that can decrease the irritating factors. What does that mean? So we can wear something with a rigid bottom shoe, which is a stiff toe shoe, like that picture there. Or if you want to wear something more comfortable, you can put a kind of a more rigid insoles inside any shoe you want to do. So these are carbon fiber insoles you can purchase over the counter. Again, if you have a bony prominence on the top of your foot, or you break great toe that is bothersome when you wear a more tight shoe wear, you can look for shoes with a wider toe box to kind of give you more volume in the forefoot. And again, these are inflammatory conditions, so things like anti-inflammatories or even dedicated focal injections with corticosteroid, or a quote-unquote a pain shot into that joint, can temporarily help to relieve the pain as well. So if any of the things that I just mentioned didn't really work for you and the symptoms are debilitating, there are surgical options at the end of the rainbow, and these are very effective. You can treat the pain as well. The goal of the surgery is obvious to minimize the motion across that joint so it's not irritating anymore, meaning that we're gluing two bones into one, and that essentially effectively eliminates the arthritis across that joint. Now, there's another condition that can mimic the arthritis of the great toe as well, and that is, you guys might be coming here, this condition is called gout. So that is more of a systemic condition that often affect the great toe joint, the same joint that can become arthritic. Well, how are these presentations different? Let's start by introduce a little bit about what gout is. Gout is a elevated uric acid, which is a product of purine breakdown. Purine is found in kind of protein in our food, and sometimes there's various conditions in our body that can lead to either the increased collection of purine or the decreased excretion or the way how we get the purine out of our body. So there's a multi-factors such as diet, kidney disease, diabetes, obesity, and there's some familial history involved with that as well. Now, what can gout present? Like I said, it can present very similar to arthritis. So you can have a sudden onset of pain, swelling, and redness. Sometimes these can actually mimic infectious symptoms as well. And often these are very hypersensitive to touch. And if you do have these flare-ups, these can be very, very painful, and most of the time people do seek medical attentions. And how do we diagnose that is through a couple things. Number one, the physician can check a uric acid level in your blood. And number two, which is kind of a more definitive diagnosis, is we can take a little bit of fluid out of your joint and put it under a microscope, and something called uric acid crystals can show up, and that will be kind of a diagnostic workup for that. Well, if you do have a gout, or the first time you have one of these flare-ups and you are diagnosed with gout, what can we do to prevent further flare-ups? They're mainly treated medically. In acute attacks, there are a number of medications we can to not only control the symptoms, but also help you to pass the uric acid out of your body. And in terms of long-term management, there are also medications or diet modifications that can prevent you from further flare-ups. Surgical management for gout is very, very rare. In very rare occasions, the uric acid can build up and creates a kind of a volume-occupying calcific, almost like a nodule along the joint. And these can put a lot of tension across the skin. And sometimes we can, to kind of prevent the skin from breaking down, we do excise that nodule, which is what we call a tophi. And moving on, another condition that's pretty common over the great toe that can give you a great deal of pain is the bunion. Now these are pretty obviously, it just catches your eye every time you see it. These are very, very characteristic deformities, meaning that the big toe turns, the tip of the big turns outward, and you have a prominent bump on the inside of the foot. And sometimes the great toe can occupy some of the space of the second toe, and in turn that kicks up the second toe and allow it to kind of result from bending, allowing it to bend forward, down. So that results in a little bit of deformity over the second toe as well. And these are most likely familial. So if you have a bunion, there's a good chance that either your immediate family member or a distant relative have a similar deformity as well. And these tend to progress over time. But the good news is most of these are asymptomatic, meaning that you can have a bunion appearing foot, but that does not limit your activity from your daily, on a daily basis whatsoever. But over time, again, these can progress over time, and the deformities gets worse enough that can very well lead to a little bit of problems in terms of increased weight-bearing stress on the rest of the toes. And I'll talk about why in a little bit as well. In the bunion, if you have symptoms, you tend to have pain over the bony prominence on the inside of your ankle. And over time, because of shoe wear, you can develop callus, painful callus around this area. And again, because the second toe is kicked up, so the toe can be unhappy, quote unquote, as well. So we can develop pain over the bottom of the second toe. And these, as you can see, tend to be kind of more space occupying. So wearing a restrictive type wear or prolonged activity can do worsen the symptoms as well. Well, to kind of reiterate why the second toe tends to be painful, if you can imagine how you're standing on a normal basis, the big toe takes a lot of weight. That's why if you take an X-ray of a big toe, it's about twice the width in terms of the bone as the rest of the toes, and that's why it's called the great toe. If the great toe turns outward, then the force transfers to the rest of the toes, and the next guy in line is the second toe. So when it's not accustomed to be having so much weight placed across it, and all of a sudden a dude takes that load, then it becomes overstressed, essentially. That's why you often develop callus or pain over the bottom of the second toe. Then how do we treat these? If you are asymptomatic, then I probably wouldn't do anything different. But in some people who are symptomatic, meaning you have pain over that toe, then the first line would be always non-operative. You can try a variety of things, like a wider toe box shoes to kind of accommodate some of the volume created by the deformity. Or you can purchase a number of products that's on the market. If you Google bunion sleeve, and there's a number of things you can purchase, but it looks like something on the picture there. The idea of that is to pad that inner bony prominence so it stops from rubbing, but also sort of straighten the big toe out temporarily. And then Another thing you can purchase, which is, I think is probably more effective, would be a silicone toe spacer. So that kind of occupies the space between the first and second toe, and also kind of holds the second toe in place so it prevents it from kicking back up. There's another product on the market called Bunion splints. They look like this. So this is something that you can sleep with it. The idea of that is to kind of keep your toes straight when you're sleeping and keep it stretched. But in my experience, they don't really work that well because, again, these non-surgical or non-operative options are treating the symptoms only, and it does not change the deformity at the end of the day. Now, if you're someone who has tried all these, has persistent problems, then that's when the last line would come in, which is something operative. Bunion surgery is a constellation of techniques, and that's highly customized to where the deformity is, how bad the deformity, and there's a saying, there's a million ways to do a bunion. So these are not as simple as people might think. So in essence, in my experience, these are reserved for those who, again, failed non-surgical options. And this is not a cosmetic surgery, but rather is a surgery that helps patients with a lot of symptoms. Now, if you're saying, doctor, I have, instead of great toe, now I have pain over the rest of the toes. What could that be? And if you look down, you might notice that rest of the toes have a little bit of curl in them. And these are called camera toes. So what these are is caused by repetitive use and imbalance of the muscles on the top and the bottom of the toes, creating what we call a hammer deformity. And these are, again, associated with a number of conditions such as bunion, tight shoe wear, and there's some genetic condition can predispose you to hammer toes as well. So these are what kind of they look like. These can be subtle or these can be obvious, like the picture shown there. These tend to develop pain over the top because you can tell it can rub over the top of the front of your shoe, or it can develop some pain over the bottom of your tip, as you can tell, then tend to kind of rub more on the bottom as well. And again, just like most of the foot and ankle conditions that are chronic, the first line is always non-surgical, and people tend to do pretty well with it. Sometimes the deformity is flexible, meaning that if you reach down and you can use your hands and see if you can stretch them straight. If you can, then that's called a flexible deformity. So the best thing you can do is to start doing some stretching exercises to kind of rebalance those deforming forces on the top or the bottom from the muscle and tendon. That can produce a pretty optimal effect over time. And then, or you can purchase something over the counter called hammer toe splints, just like that picture shown, that can help you pull that toe down with a splint, and you can certainly wear that in any shoe you want to. And again, you can always purchase a wide or deep toe box shoes to accommodate some of the volume and minimize some of the rubbing over the top. In case, for those few, again, who still have painful symptoms despite everything I mentioned just now, then there are surgical options. And I'm not going to mention too much into it, but just know that there is always kind of a last line treatment option for that. And then if you move to the kind of the outer side of your foot, you can see on that gray area, it's more kind of on the tip of or kind of the side of your foot where the fifth toe is. And if you have some of that, and some of you might notice there's just like a bunion, there might be a bump on the outer side too. That can cause pain and rubbing and callus. And that's something called a Bunionette, just like that picture shows. Sometimes it's very subtle as well. And these are prominent bony deformities at the base of the little toe. And what these can do is it can cause pain on the outside, callus swelling, and again, aggravated by a tight footwear. And what do you do with these? Again, same as bunion. You can wear something wider shoes that accommodate the volume. There is a little bit of toe spacer or bunion pads you can see on the picture that prevents some of the rubbing that can happen that can give you pain. And obviously, if these are not effective in controlling your symptoms, there are surgical managements as well, but these are very rare. And then moving on to kind of further back, these are kind of like the top of your midfoot there, kind of where the toe leads to. And if you have pain in these areas, actually it's quite common. Most commonly is due to what we call a metatarsalgia. It's a word that's a mouthful to say, but what that really means is called a transfer pain or pain in the ball of your foot. So these are pains of the lesser toes for some reason has taken on more stress on them than they're used to. So they're pains across the bones that's, that can be associated with a lot of other conditions, such as great toe arthritis, as because you're not putting too much pressure on the great toe because it's painful, then the pressure shifted to the rest of the toes, such as bunion. Same idea. The great toe is not doing its job effectively. The pressure is shifting the rest of the toes. Same thing with the flat foot. As your foot is turning outward, then the pressure also transfers on the outside. And then there is a specific shape of the foot. It's called a Morton's foot. Actually, it's more common among us. About 80% of us has this shape of the foot. What that essentially means is your second toe is the longest toe in your foot. And what that means is your second toe is at more risk in taking on more stress. And that's what it means. And these people can also at more risk of developing, metatarsalgia, with the pain in the ball of your foot. And what they present us is, as you can see, you can have a callus in various portions, kind of on the tip of your, on the bottom of your feet. That just means you're putting more pressure than you're used to across the bones. And these can be painful, and these can be aggravated by weight bearing. And most commonly, because if the big toe is not doing its job correctly, then the second and third toe are the next two soldiers in line, and they take out more stress, so they're more commonly irritated as well. And then, interestingly, one thing that differentiates metatarsalgia from what I'm going to say the next symptoms would be usually these, you don't have any swelling across these and strictly pain. Well, what if I have swelling? So if someone comes in with a swollen foot, very painful in the same area, and you ask them and they will say, I did a long hike over the weekend, or I made a trip to Europe and then did a lot of walking, or I ran a marathon, 2 days ago. These are commonly can be related to a stress reaction across the bone, and can be even called stress fractures. And what differentiates these symptoms from a metatarsalgia is usually they can be associated with swelling. So if you have swelling across the forefoot and this had a very sudden onset, I would suggest you to go to somewhere you can get an x-ray of your foot to make sure you don't have the condition, because it does affect the treatment a little bit. Well, let's go back a few slides and kind of differentiate how do you treat the two things differently. The metatarsalgia, because it's a chronic overload, so the non-steroidal treatments are designed to relieve some of the pressure across these toes. So things like padding, just like what you picture showed, where kind of on the bottom of your foot, placed just behind where the painful area, makes these pads takes more load inside of the bone. And then you can always also try some soft accommodated insoles to place inside the foot to release some of the pressure. And then again, if you're doing a whole lot of walking in the recent times, or part of your exercise routine, and these bothers you over time, you can adjust those activities until the symptoms go away. Then how do we treat the stress fractures? So these are exclusively non-operatively as a first line, because these are caused by a sudden increase of activities. So and these are caused by essentially a break in the bone. So the best thing to do is to rest and protect your weight bearing for a shorter period of time until you feel better, or there is radiographic evidence that the bone is healing well. Again, these can take a little while to get better, so patience is the key. And again, we have to kind of look at the alignment of the foot to make sure we treat the underlying problems to prevent further occurrence of these symptoms. Now, if you have pain in the middle of your foot, and you're wondering, these pain has been there for a long time, and again, worse with long walking or long standing, and sometimes you see some swelling in that same area, what would that be? And this is your midfoot. The midfoot is an interesting structure. It has little bones, and these little bones are connected to other bones in the midfoot by little joints. And these joints essentially have very little motion. The reason is these midfoot are essentially made to propel you forward and allow the transfer of the weight force from the toes to your ankle, and that's kind of how you walk. But over time, because these are little joints that really don't move that well, innately, they do develop some degenerative changes over time. So these are often called midfoot arthritis, just like any other degenerative changes. And again, these symptoms can present as pain, swelling. Sometimes you can have bone spurs, just like any other arthritic conditions. And these bone spurs are often forming on the top of the foot. That can lead to some problems. And then, again, these can be worse with weight-bearing activities or anytime you put some stress across the midfoot. And how do we treat these? Again, the first line is always non-operative, and people do very well with these. The goal of the non-operative treatment is to kind of minimize the stress you're placed across the midfoot. So if you go back a couple slides, if we go back, there's a picture of the midfoot. You can see the midfoot is kind of the top of the arch of your foot. So if the top of the arch is not doing very well, there's a couple ways we can help it. First, we can put something below to support the foundation so it's not more suspended in the air, which is a arch support. And then you can try a rocker bottom shoe. So these things are have an arch built underneath the shoes that help you propel you forward, so the midfoot doesn't have to do as much. And then if you have a painful area on the top of your foot that's from bone spur, and some of these are very painful from different lacings, shoelaces, or very tight pressure on them. There you can lace your shoes differently to kind of bypass that painful area. And believe it or not, these are actually quite successful in treating most people's symptoms. And then again, these are the arch support. And then you can modify your activities at the end of the day as well. If the walking or running or some of the things that aggravates it, try to find something different, like maybe biking or swimming, that put a little bit less stress across the midfoot. And then we're kind of going to the back portion of your foot into the heel territory. So these are pains. If you can push on it, it would be kind of on the inner side or toward the back of your heel on the plantar portion or the bottom portion. And these are often pretty painful, especially if you put weight across them, if you walk during the day, at the end of the day, or even if you wake up the first step in the morning. And sometimes you can see on the bottom right picture, it feels like you have a pin stabbing that area. And believe it or not, these are very commonly felt with people. And at least in my experience, this is one of the most common things people come and see me about and want to kind of learn some of the treatment we can offer. So these are called plantar fasciitis. What plantar fasciitis is the inflammation of something called a plantar fascia due to a chronic overuse. What plantar fascia is a really tight band of ligament that connects the ball of the foot to the heel. And often when these structures are overused or irritated, the first area that becomes irritated is where it kind of becomes part of the heel, which is the back on the bottom. And again, these are very common problems. A lot of people can experience during some point in their life. And there are some risk factors that lead to that, such as endurance activities. You can have a tight calf muscle that makes, essentially we'll talk about that in a little while as well. That can lead to kind of more stress placed across the plantar fascia. And then obviously a little bit of weight that we carry doesn't help at all either. And how do you really know that you have plantar fascia if you have pain in that area as opposed to something else? So these are kind of the characteristic symptoms. Something called startup pain. So the first step you take in the morning or the first step you take after you're inactive or sitting down for a long time. What startup pain is a kind of big stretch on this tight ligament that can be contracted throughout the night or contracted when you are not doing much. So that the big moment of stretching, the first moment you stretch, can be very irritating to the structure. Calf tightness. Again, calf is part of your Achilles tendon. When your Achilles is tight, it puts a little more pressure across the plantar fascia, because after all, they're all connected to the heel, and the plantar fascia can act up as a compensatory mechanism. And flat foot or high arch foot as well. If you have a little bit of anatomic disadvantage, either way, that plantar fascia can be either overstressed or over-tightened, which can cause pain and symptoms as well. Well, how do we deal with? The good news is, it's very, very curable with non-surgical options. And usually I look at these things as the first three options are all stretching. So the reason that you have the pain across the plantar fascia is because it's tight. So the reason that people do very well with it is often if you get the tightness out, makes it more flexible, then the symptoms miraculously disappears. So there's a couple of stretching exercises that I like to tell my patients to do at all times. If you had to pick one, pick the one on the upper right. It's called a plantar fascia massage. So what that means is you take a seat and then you put the painful foot on the thigh. You take your hand and make sure you're bending the toe back. The moment you bend your toe back, you will be able to feel that tight band underneath your foot. And you take your other hand and just really find that painful spot. And you just kind of massage for about 30 seconds to a minute. It might be very painful when you're doing it, but you feel a lot better immediately after. And you do this, pretty much at least 3 times or as many times you want. Just like any stretching in our daily routine, or the more you do it, the more flexible it is and less pain it will be. The second thing I like to recommend is just like the picture in the bottom right shows, if someone who's have a problem sitting down or have a difficult time finding a place to sit down, then or they're on their feet all the time at work or for other reasons, you can find a wall or a countertop or anything, rigid. You make sure you put the toes on that structure to make sure you're bending the toe back, just like the picture above it shows. As long as you're bending the toe back, you're putting that stretch on the plantar fascia. And all you have to do is lean forward and hold that position for about 30 seconds to a minute. And you do that as well as many times in a day as you can. Again, the idea is to do your best to get those structures that's tight flexible again. The more flexible it is, the less painful it will be. And then, most of the time, if you do it enough, do it over time with patients, they do get better over time. And there are some technological gains that we have discovered, such as a shockwave therapy that can help the symptoms as well. So if you have chronic symptoms that's not going away with stretching exercises for more than 6 months, you can go to one of us or one of the local physicians that can refer you to one of the locations that do these type of technology, shockwave therapies, and that has shown to help as well. Now, if none of the other things are working, or none of the things we have mentioned above are working, there are surgical options for these as well. But before that, you can try some other things that can help, such as you can purchase an arch support that essentially put a little bit of a stretch on the bottom. You can purchase one of the heel cups, again, pad the painful area. These are nice splints. People sometimes purchase them so you can sleep with them to make sure the curls don't contract during the night, so you have an easier time to get up and go in the morning. And then if the pain is too severe, then you can try one of the immobilizations, such as boot brace or cast, as kind of a resting type of option. And then if you try these non-operative, like I mentioned, these are very successful. In my experience, over 95% people do get better over time. Now there are, again, I mentioned surgical options, and I'm not diving too deep into that, but these are options for those people who still has persistent debilitating pains after all these non-surgical options have been tried. And then next thing is if you had pain in the back, not on the bottom, the back of your heel, what would that be? And there's one structure in the back. The main structure in the back is something called Achilles. Achilles tendon is one of the biggest tendon in your leg, and it does a whole lot of work to get us to point A to point B. Every time we walk, run, or even stand, we are putting a tremendous amount of stress over the Achilles tendon. And these tendons do become inflamed over time from overuse. So these are called Achilles tendonitis. Also one of the most common things I see in my clinic. There are two types, insertional and non-insertional. What that means is Achilles tendon is a tendon that connects the calf muscle belly to your heel. So there's two common places it can be irritated. One is where it inserts into the heel, so where the tendon becomes the bone, or the other place is that within the actual tendon belly. So if you look at this picture, there is a bump or swelling kind of lower, kind of right in the back of your heel. And these often feels pretty hard, just like a solid bone. So these are called insertional Achilles tendonitis. Then you can have another population. It might be not very obvious on this picture, but you see a little bit of swelling higher above, kind of where, in the back of the ankle as opposed to the back of the heel. So these are swelling within the actual tendons, or non-insertional Achilles tendonitis. Sometimes it's important to differentiate these two because the treatment options do differentiate a little bit as well. So how do we treat these? I usually start them right away with kind of a phase-based treatment options. I divide these things in three phases because when the reason of you having Achilles tendons is because you've been overusing them over a period of time. So the first phase, in my opinion, is resting. The second phase is rehabilitation to get you back rehabbed, stronger, more balanced. And the third phase is after you're done well with the first and second phase to get you back to your regular activities and carry on with life. So what does first phase mean? Rest. Rest meaning that somehow we have to lessen the workload across the Achilles tendons. We can try a little bit of activity modification. If you're a runner and it's painful to run, then maybe stop running for a little while until you feel better. Sometimes if the pain is too severe, even with every steps, then we can try different mechanism to immobilize the ankle, because after all, every time we move our ankle up and down, we are using the Achilles tendons to do that. So things like a walking boot can help you significantly to help you rest the Achilles tendons altogether. Things like a heel lift, that can bump up the heel a little bit to kind of lessen the stress across the Achilles tendon. Things like a heel pad. If you have a pain from the swelling in the back of your ankle, touching the shoe or the boot you wear, then you can purchase a heel pad that can pad that area of the swelling that makes you feel a lot more comfortable. And again, there is always the medications, because it is an inflammatory condition. You can purchase any of the anti-inflammatory options over the counter, and things like ice as well. Now, when does the first phase end? It ends when, say you push on it, or I push on it when you came in to see me, and you say, oh wow, that pain has gone away, or the pain has significantly improved, or the swelling has completely gone. Then I would say you're probably graduated from phase one, and you're ready for some rehabilitation. And that's when the rehab comes in. And what we do from rehab is we wean you from any type of immobilization measures we might have placed. We start some gentle stretches or range of motion exercises. Then if you do well, then we transition you to more strengthening exercises later on. Again, it's a very stepwise fashion. And then there are some techniques we can use to get some medications locally into the area. And that can also help with the inflammation that can occur from the rehab. Now, usually these things can happen anywhere between 6 to 12 weeks. Now, if you do well with the rehabilitation, you should feel pretty good. And that time, we're trying to get you up to the third phase, which is regular activity. So we can transition you to your things you like to do, running, jumping, hiking, any of the things that you like to do or used to do before all the symptoms started. Now, if you, in my experience, if you a patient with it and you stick with the phase, kind of phase stepwise treatment, These are pretty successful. In my experience, about over 90% people do well and be able to return to their regular activities. And for those people who still has problems or setbacks or recurrent issues, there are surgical options at the end of the day for these. But again, the surgical options, the necessity of surgical options are rare. And again, they do, like I mentioned, they do differs a little bit between insertional type and non-insertional type. But I'm not going to dive too much into it. But just knowing that there are successful surgeries that can help to get you back on the feet as well. Well, that concludes my presentation today. Again, I'm very happy and honored to stand in front of you to kind of discuss a little bit of what I do on a daily basis and what I see on a daily basis, and hopefully you learn a little bit of the common problems that can happen around the foot and ankle. And I'm happy to take any questions that you can have.
Great.
Thank you.
Thank you, Dr. Liu. Can ingrown toenail cause pain midway up the foot with high arches?
So, good question. So again, we relate to about how the shape of your foot can cause problems. So if you have a high arch, sometimes your toes tend to point more downward. So yes, that means that your toenail might be facing more down or moving more pressure toward the front of the shoe or the bottom of your toes. And yes, that can predispose to maybe ingrown toenails if you overlook some of the growth around the nail. And yes, so the question, the answer to that is yes, you can have problems. But knowing that ingrown toenail can happen doesn't matter if you have a high arch or a normal shaped foot. It's one of the things that most of the time it can happen just from a draw of a straw. But it's very important to make sure to inspect your foot before the ingrown toenail becomes more of a problem, more of an infectious problem. So if you have pain and you have difficulty with, around the nail, it might be a good idea to seek some medical experts to take a look at it and maybe not only shorten the nail, but also put some antibiotics to prevent the infection from getting worse.
I have small broken bones in my foot from basketball and with on and off pain. Is surgery the only option? Shoes, inserts, painkillers did not help, and I hear surgery has a long recovery and it's not always successful.
It depends on what bone you break, really. So that would be kind of an interesting question to answer without knowing, an actual bone, without having an x-ray. So if you haven't had anyone to look at it, or I guess you have because you have someone recommending surgery, it will be interesting to see, what is the actual problem. Now, if you have a chronic issue that's not getting better, say in the course of 6 to 8 weeks or so, because usually that's the amount of time it takes the bone to heal. If you still have that chronic problem, it's probably good to at least go back to the physicians to have a second look, just to make sure, number one, you're healing right, or number two, if you don't have any other associated problem with it.
I have diabetes and in recent years my arches have collapsed. Although I don't feel pain, should I be concerned?
Diabetes, again, very common problem. The problem with diabetes is commonly associated with neuropathy. So I wouldn't take that without pain as a reliable indicator of something not serious is going on. Now, if you have diabetes and you have very full sensation, and these can be accomplished by what we call a monofilament test, and these can be done in any physician's office to kind of make sure you have a full sensation. If you have a good sensation and if you have no pain, then I would say you probably are in a pretty good place. But if you have essentially a decreased sensation or no sensation or severe neuropathy, I will probably be at least be more cautious in taking the next step. Now, I would make sure to check on your feet daily, make sure you don't have open wounds. Now, if you have a flat foot that has getting progressively worse, especially if you have some more pressure points caused by the flat foot, I would recommend go to a physician, or either a family doctor, or at least have an expert to look at it. Make sure you don't need a specialized referral. But I would recommend to essentially just pay closer attention to your feet.
I am flat-foot and tend to get shin splits when I run. Do you recommend stretching before and after running?
Yeah, stretching is always a good option. There's no harm in doing that. Shin splints are, I didn't really address anything associated problem higher up from flat foot, but it is also associated with flat foot, just because that when the foot turns a little outward, there's a little bit more stress placed across the shin bone as well. What I also suggest is maybe purchase a pair of medial arch support or insoles to place in the foot to kind of just help the flat foot to get your foot more underneath your leg per se, and that probably would more reliably reduce the forces or the stress across the shin bone, and you probably notice a little difference.
I have a bunion on my right foot but not on my left. Is that common? And it hurts at times, so should I start leading with my left foot to relieve the pain?
Bunion is usually familial, and I most of the time see kind of bunions on both sides, but certainly one side can be worse than the other side. If it's painful, then I would try to do something to help it, either start with something accommodated shoe wear, like I mentioned before, maybe a little bit of toe spacer to kind of get the toe more underneath you. Again, it depends on where the pain is. And try that. If it helps relieve the pain, then perfect. If it doesn't, then I would say maybe come and see one of us or one of the physicians so we can take another look at you to make sure we didn't miss anything.
Is it better to use ice or use heat for plantar fasciitis?
Good question. So plantar fascia is a inflammatory condition. So when it's flaring up is acute flare-up inflammation. So in my opinion, ice probably works better in that scenario. Now, there are something called a frozen can roll that I didn't address. That's probably my third go-to, other than the plantar fascia massage and the toe stretch on the counter, will be something called either a tennis ball roll or a frozen can roll, that if you have a water bottle, put it in the freezer, and they become a pretty solid roll. And if you're sitting down in your office or in front of your computer working at home, you can just roll that kind of cold ice block underneath your foot. That can give it a pretty good relief. So I would say I would lean more toward the ice than the heat.
Okay, and the last question. I try to lead an active life and enjoy hiking, CrossFit, and running, but many times my feet feel sore because I have high arches. How do I choose the right shoes for different activities?
Great question. If you know you have high arches, I imagine you are probably more disposed to pain on the outer side or even ankle sprains. Now, there are customized orthotics that you can purchase or made by one of the brace shops that kind of even out, basically bump up the outer side of your foot. So basically the reverse, essentially considered a reverse of the medial arch support that you can more commonly found over the counter. So if you have a high arch and you know you have a high arch, and you have symptoms from your activities, I would come and see either one of us or even your primary care physician, so they can often refer you to one of these brace shops with a customized prescription, so they can make a customized orthotics for you to kind of even up the pressure from your high arch. Now, most people who do have high arch, they end up getting a medial arch support that you can more commonly found over the counter. That essentially worsens the issue. If you already have an high arch and you purchased another medial support, that essentially puts more pressure on the outside. So that's why if you have a high arch and you know you have a high arch, I would come into one of us to make sure you have that condition. Again, because the insoles for the high arch are much more rare to find over the counter.
Okay. This concludes our program. Thank you, Dr. Liu, for your
Thank you.
expertise. And thank you to our viewers for tuning in. The entire broadcast of today's event will be available on Facebook page. We look forward to hosting more Facebook Live events in the future.